Good afternoon. Welcome to the ER at Mediocre Memorial. I'm Dr. Killpatient. How can I help you?
Hi, Dr. Killpatient. I am Mrs. O'Hara. I just fell off a stepladder at home and injured my back. I am in very severe pain. Can you help me?
Perhaps. But to be honest, Mrs. O'Hara, you don't appear to be in very much pain.
What do you mean? I am in agony right now and I have been waiting 12 hours in the most uncomfortable chairs ever designed by man, just to see you.
We get people in here every night claiming to be in pain. If you really injured your back, you would be writhing in agony on the floor and puking your guts up.
What am I supposed to do? Cry? If you don't believe me, why don't you do a CAT scan? I also have a history of back pain from a previous injury. Why don't you contact my primary care doctor?
If you have a primary care doctor, he should be treating your pain, not me. The ER is for life-threatening emergencies only. Besides, one of our nurses took time out from her busy schedule to observe you eating Cheetos in the waiting room. If you were really in pain, you wouldn't be able to eat.
Well, I have had severe chronic pain for 3 years, and believe it or not, people with pain do eat food from time to time. But this is a new injury, and the pain is worse than ever. I also have fibromyalgia.
If I had back pain, I would run 5 miles a day until it went away. As for fibromyalgia, that is not a real disease. It is a psychiatric condition that frustrated women, like you, develop as a coping mechanism to avoid dealing with feelings of inferiority and hostility towards men.
Oh my freaking God. This is unbelievable. Look, can I just get a CAT scan already?
That's fine with me. It's your money. But I doubt it will show anything. You should really go to a psychiatrist, not the ER. You have a conversion disorder.
Whatever. In the meantime, can you maybe give me something real for my imaginary pain? When I first injured my back, they gave this stuff called Doradilidon.
Dilaudid?
No. Doradilidori.
Demerol?
No. Dory or something.
Morphine?
No, it was Dora. It was Doradil.
Doradil? You mean Toradol? Phew. For a second there I thought you were one of those drug-seeking scumbags trying to score narcotics for your quote-unquote pain. No, Toradol is fine. In fact, it is more than fine. It is a wonder drug. It is the best drug ever designed by man. Toradol can do everything. It relieves every kind of pain there is. It can cure cancer, bubonic plague, typhoid fever, beriberi, erectile dysfunction, endometriosis, hyperactivity and the clap. If you put it in your gas tank, you will get 150 miles per gallon. You can speak to the dead while you're on it.
Whatever. Just don't give me Dilaudid. They gave that to me one time, and it made me sick to my stomach. I think I might be allergic to it.
Oh, so you're allergic to Dilaudid? You know, you almost had me there for a while. The only reason you asked for Toradol is so that you could fool me into thinking you're not a drug-seeking scumbag. I bet you thought I would give you morphine anyway, didn't you? I have been a doctor for 20 years and I know all the tricks you people play.
What the hell are you talking about? Toradol really did work, and I really am allergic to Dilaudid. What difference does it make what you give me, so long as it works?
It makes all the difference in the world. There are only 2 kinds of people in the world who know what Dilaudid is, doctors and drug addicts, and I don't see an MD after your name. I can give you a shot of Toradol, but I cannot treat pain with something that actually works, unless I see objective evidence that you are in fact in pain.
Good grief. Is my CAT scan back yet? This is too much.
Oh, I have your CAT scan right here. It turns out you have 2 fractured vertebrae in the L4, L5 region.
I told you I was in pain. Will you give me something for the pain now?
Not so fast, Mrs. O'Hara. It is the policy of this hospital not to treat chronic pain in the ER. We only treat acute pain. We feel it would not be in the interests of our patients to do otherwise, though we will happily take their money. Do you have evidence that this damage to your back is not in fact the result of your previous injury? If that is the case, your pain is chronic and cannot be treated here.
This is insane. What difference does it make if my pain is acute or chronic? I am in pain. I need help.
If we treated chronic pain here, this place would be drug seeker central. Sorry, but like I said, we only treat life-threatening emergencies in the ER.
Hachu.
Oh my God, your coughing and sneezing sounds serious. You must have a cold. You need to be on ciprofloxacin.
Wait a second. I thought you only treated life-threatening emergencies in the ER. And besides, why would you give ciprofloxacin for a cold?
This is a life-threatening emergency. If you develop pneumonia and die, I could be sued for malpractice. Now take your Cipro and shut up. I will not tolerate non-compliance. You have to do what I tell you to do. Respect my authority.
I refuse to take an antibiotic for a cold. That's crazy.
Oh, so now you're a doctor as well as a drug seeker? The drug rep told me Cipro works for colds, and he went to Harvard Medical School. What medical school did you go to? That's right, I thought so. You probably never graduated high school, but suddenly you think you know more about medicine than I do.
My 5-year-old knows more about medicine than you do.
Oh, so now you're dragging your kid into it in an attempt to get sympathy from me. That's despicable. You have Munchausen by proxy syndrome. You are a bad mother. I'm calling Child Protective Services as well as security. O'Hara. That is an Irish name. You must be an alcoholic. That is why you fell off the ladder, and why you are trying to score narcotics. It is also why you are a bad mother with fibromyalgia. You need to take personal responsibility for your psychiatric and substance abuse problems, and stop clogging up the ER with your bogus complaints of pain.
I do not have a substance abuse problem or a psychiatric disorder. I injured my back. That is what I am here for. Why won't you treat my pain? I am paying a lot of money for this visit.
Wrong. You are a Cheetos-eating, cell phone-using drug seeker, and you have a personality disorder called fibromyalgia. If I gave you drugs you would give them to your kid to sell at school, and I have a moral responsibility to protect society from mothers like you and your drug-dealing kids.
You are completely incapable of reason, logic or human compassion.
That is correct. My superhuman mental faculties derive their godlike powers from the apotheosis of my ego to the realm of pure narcissistic consummation known only to the noblest practitioners of the medical art. I have little use for the petty reason of mere mortals like you, and your childlike compassion would corrupt the purity of my egocentric transcendence.
You are insane. You have a God complex.
No. God has a doctor complex. He wishes he could be more like me. Now if you don't mind, I have to recharge my God powers by masturbating to myself in the mirror. Have a nice day.
I am going to another ER to get treatment. Maybe I'll find a real doctor there. You're a sicko.
The nurse has already alerted every ER, pharmacy and doctor's office within 1,000 miles that you are a drug seeker, and rest assured you will be treated with the utmost contempt, no matter where you go. I hope you are satisfied with the high-quality, compassionate care we have provided you in our state-of-the-art facilities. Be sure to pay the bill on time or we will kill your kids.